Hello, my name is Zach. Today we're going to be talking about cranial nerve 9, which is also known as the glossopharyngeal nerve. The glossopharyngeal nerve is considered a bilateral cranial nerve, meaning it comes out of the medulla on either side. The glossopharyngeal nerve has both sensory and motor neurons. Sensory information gathered into the glossopharyngeal nerve will come from your sections of your outer ear and also tympanic membrane, which is inside the ear. It will also come from areas from the pharynx branch, which would be your pharynx, your larynx, and tonsils. It will also gather sensory information from the posterior 1/3 of the tongue, which would be taste. Some motor information that would come from the medulla through the glossopharyngeal nerve would be to the stylopharyngeal fibers, which would aid in swallowing, and also to the parotid salivary gland. Lastly, it would branch down to the carotid sinus body, which would be a sensory neuron. I'm going to present the glossopharyngeal tract. The glossopharyngeal tract starts at the medulla. It then comes through the jugular foramen of the head. It would then need to pass both superior and inferior ganglion. And then we're going to come to a crossroad of branches of the glossopharyngeal nerve. One will be the octic ganglion and parotid salivary gland, along with the branches of the pharyngeal, as well as the lingual branch that comes off of the pharyngeal branch, and then the stylopharyngeal fibers. From the octic ganglion, like was mentioned before, we'll receive sensory information from the ear. The parotid salivary gland will receive the motor, and the pharyngeal branches will receive the sensory from the pharynx, which is located posterior to the tongue. Then we'll branch all the way down to the carotid sinus branch, which will then, we can receive our sensory information from the carotid sinus. We have 6 tests that can be performed for glossopharyngeal nerve, cranial nerve 9, but cranial nerve 9 is very close to cranial nerve 8 and 10. So a lot of these tests can be performed alongside 8 and 10, not just cranial nerve 9. The first test, which would be swallowing, is testing the pharynx and the larynx. So you would ask the patient to swallow. Second test would be pronouncing your vowels, A, E, I, O, and U, which would then test the soft palate. And third would be your very typical test, which is asking the patient to extend the tongue and say so then the doctor or therapist can see the rise of the palate in the uvula. Okay, so a fourth test that we can conduct on the glossopharyngeal nerve would be the Gag Reflex Test. What we are looking for is if the patient has a gag reflex sensation or not. The test is performed using 2 tongue depressors. One is to hold the tongue down, while the second tongue depressor is inserted to stimulate the areas at the back of the throat. A lack of a gag reflex would mean a diminished sensation, which would possibly indicate a discrepancy within the glossopharyngeal nerve. A fifth test, which we call air through the nose. You'll have the patient force air through their lips, having their cheeks puff out. You may notice an airflow sound coming through the nasal cavity. That would indicate that areas of the nasal pharynx are not communicating correctly and not shutting off the pathway to the nose. A sixth test would be a simple taste test. It's just simply asking the patient if they have any type of loss of taste, and especially in that posterior 1/3 of the tongue. So this concludes the cranial nerve 9 glossopharyngeal nerve.